As another part of our focus at Jamf around mobility, we've been thinking through new ways that devices can be used to make people powerful. It's a common theme. And in many cases, this is a non-IT user doing something that in the past was very technical in nature. Now, some of you may remember last year when we introduced two new user-focused applications, Jamf Setup and Jamf Reset. These apps allow a user to either provision or reset their device based on their current needs. For example, maybe you're a retail environment and you have a pool of iOS devices for training in the back, but during holiday times, you need to repurpose them for front-of-house point-of-sale. In other situations, you may have a need to provision a device just based on a change in environment. So with Jamf Setup and Jamf Reset, all of these scenarios are possible without having to open an IT ticket or wait for support. So if we look back into healthcare, there's yet another iOS use case that has emerged that is now benefiting patients in an entirely new way, keeping them connected to their care teams after they're discharged from the hospital. But when the need of the patient extends beyond the four walls of the facility and the requirements of their care change from one person to another, there's a lot to consider as to how to make this all possible. And so with that, we partnered with Locus Health to pull it all together. I'd like to invite Lindsey Koshansky, Vice President of Clinical Innovation, to the stage to tell you the story.
Thank you, Adam. I stand between you and your session, so we're going to keep this short. But thanks for having me, and thanks, JNUC. I hope you guys are having a great conference. At Locus, we believe bridging the gap between hospital and home is really key to patient success and a really transformative way for the healthcare system to start to take better care of the patients. They leave a really well-controlled environment at the hospital where they're well monitored. As you heard earlier, they have lots of people keeping eyes on them. And they go home to, at best, being sent home with papers and a binder and a pen to be able to record what's happening for them. So we developed an iOS-based solution that lives on an iPad, and we deploy it to patients after they leave the hospital. We really prioritize patient engagement because we have to remove many barriers to make sure that patients are going to use the tool properly. But we also had to prioritize security, ease of use for deployment. So I want to share a little bit of that with you today. And as you can see in this demo, we made the user interface really simple and streamlined. So when a patient logs in each day, they're seeing exactly what's been ordered for them. The platform's configurable, and it's tailored for the clinicians to be able to order exactly what the patient needs to be entering each day. They can enter in videos and pictures, and in combination with trends, that really gives the clinician a real insight into what's happening at home. The patient has their own insights so that they can see what's happening, and they can share that with multiple providers across their care plan. And they also have a digital library where they're able to access information. So really taking everything that they've been given either through paper or verbally from their clinical team at discharge and streamlining it into one tool so that they can communicate properly back with their care team. And after that data is submitted, it's coming back into the hospital system. So their clinical teams are able to view this data. This is a demo of the app that the clinician is able to log into and see the information right at their fingertips. It's coming back in a couple different ways. This is one example. And the clinicians can also see trends, make really informed decisions about what they're seeing. Maybe there's additional calculations with these trends. They're also seeing, as I shared before, the pictures and the videos, survey responses, and able to make a timely intervention with their patients and either get them back in to be seen or reassure them that they're doing really well at home. But we're not just the technology solution, and it's a fully managed program. So with our tool, the clinicians have the opportunity to intervene sooner and make timely interventions. But we also recognize that setting up these monitoring programs is very new for our clinical partners and really new for the health systems that we work with. So we deploy our nurses actually for our implementation team, and they work with our teams through design and implementation of the tool and stay involved and help with the support and the training of the tool for them. But we also need an effective deployment. We have to make sure that when we're introducing this new technology to their plan and their discharge process, that it's seamless and really easy for them to use. And so not only are we supporting the design and implementation and the education and the training, but we also have a help desk, and we support the logistics of those iPads going back and forth. But sending iPads home, as you can imagine, is a little bit like the Wild Wild West. But I'm positive our iPads can tell some really great stories after being in a patient's home. And so the patients are leaving the hospital, and we have no line of sight into their home environment. We have no line of sight into what they're experiencing with the device. And so our goal was to really create a unique experience with the iPad, create a healthcare appliance with that, and provide a managed solution that would allow for easy user adoption and also a seamless communication, and removing all the barriers and the questions of, does a patient even know what a smart device is? Do they have Wi-Fi in the home? Are they covered under a data plan? Wanted to remove those barriers and provide one tool that made it easy for patients to get into the program. So we recognized we needed a mobile device management tool. We needed to control the data usage, and we needed to provide apps based on the program specifications. We white labeled the solution, so the hospital logo is on all of the iPads that we deploy, really extending care beyond those hospital walls and making it feel like the hospital and that care team is going home with the patient. But each program is really different, and our patients come from many different backgrounds. They have different socioeconomic levels, healthcare literacy. Some of them don't even know what a smart device is. But one of those as I mentioned earlier, one of the biggest parts of that process is making sure that our clinical teams have an easy way to deploy that tool. We definitely cannot expect a clinician to be IT. So Jamf has really enabled our solution in a key and critical way. Key because, as I mentioned earlier, one of our #1 objectives was making sure that the patient experience was solid and in place, but also critical because obviously being in healthcare, security and management of that tool has to be a top priority. So we're able to control that configuration, tailor that experience for the intended use. And Jamf enables our ability to manage the iPads for the program and provide a really secure tool. But we're also able to confidently answer the question when the clinicians ask, how are we going to deploy these iPads and how our patients are going to use it? And it's really easy to answer them because we feel confident telling them they're going to be confident deploying a tool that's secure, managed, and going to be a really easy thing for them to be able to deploy their patients and feel confident that they're going to get it back and be able to use it again with the next patient. So we were initially deploying devices. We were able to manage the location. We were able to configure the apps, but have since made really big ongoing improvements to how we support this tool and how we're able to get iPads in and out and set them up with programs. So many of our programs, we have some episodes of care where patients are using this in a very short period of time, so there's high iPad turnover. And we have other episodes of care that the iPad is out in the field for a really long time. So those varying time of using the device can create a lot of logistical changeover, and we needed to make that seamless. So many of our programs have grown, obviously, in flexibility and patient volumes, but also in program growth. And so that's where Jamf setup came in. So as we deployed one program and then a hospital would grow to many programs, we wanted to find the ability to centralize the iPads that a health system was using. And so Jamf setup allowed for us to have multiple programs running at one hospital with one pool of iPads and being able to deploy an iPad and choose easily what program that they needed configured. But also at the end of the episode, we needed to make it easy, whether it be Locus turning that iPad over or the clinician receiving that iPad back from the patient, utilizing Jamf Reset to clear that iPad, not only digitally, but protect patient privacy. And again, they're really busy, so they need it to be seamless and easy. And the education of that for our clinicians takes about 10 seconds, which is awesome because that's about the attention that they have for you when you're training them on some of these things. So the workflow enables not only the deployment with ease, but for the clinician, but also for the patient and family. Because our top priority is making sure that these patients are getting home and they're focusing on transitioning home from the hospital, recovering, and allowing the family to care for their loved one in a really meaningful way and enable that care at home. So once we've had that framework in place with Jamf, the programs really started to grow, as I mentioned. And at UVA, we started there about 3.5 years ago with one program and 10 iPads, which seemed like a really big deal at the time. But since then, UVA's expanded to over 8 programs, and we circulate hundreds of iPads through their system each day. So instead of separate inventories, we're now able to pool those iPads. A clinician pulls it, they choose their program with Jamf setup, and then they're able to get a patient started with ease. And again, like I mentioned, they're able to get it reset and feel confident that they've cleaned it properly and they're able to give it to the next patient. And as a result, our programs are reporting decreased readmissions, decreased length of stay, improvements in feedings for newborns at home, increased throughput of patients through units, better utilization of clinic visits, and increased patient satisfaction. At one of our hospitals, at OHSU Dornbecker, they just reported an 11-day decrease in length of stay for NICU babies that were able to go home with a Locus iPad. I just want to point out that when a baby's born, if any of you have unfortunately had to experience a baby going to the NICU after birth, every day is very meaningful for a family. So if we're able to enable our care teams with a tool and they're able to send even 1 day home sooner a child with their family and extend that care and monitor them properly is a really tremendous impact on a family. Them, but also the healthcare system and the care that they're able to provide. So healthcare is transforming, and at Locus, we really believe the ability to provide the care at home is a critical part of how health systems should be approaching care, but also maintain security, which sometimes means nothing. So in turn, the clinicians feel capable and able to send a patient home with this dependable tool and manage properly, and we're able to provide that whole experience that we set out to do initially. So thank you guys for having me. Enjoy your JNUC.